We are using the HCI platform. We just started about a year ago, and we started because we wanted to, of course, do the assessments, and the information that we had for secondary, it's all over the board. So when we saw the product, we were kind of going, you know what, this is exactly what we're looking for. And the main thing that we've used it for is just getting all the health indicator data. And it's been amazing because we just started the process of assessments about 6 months ago, and then going into the communities and getting the coalitions interested in helping us, especially in the public health areas and some of our hospitals. We've walked in and said, hey, we've got this product. We'd like you to help us use it in your community. And everybody has just it's been phenomenal. Way more than I ever anticipated. The health departments themselves, we have the state of the state report and the county rankings. This is all nice and together, and people are finding it easy to access because they go to each of our hospital sites, wherever they want to go, and they can click and they're there. And it's so much easier than some of the other websites that many people have been using for years. So that's what has been so exciting about it, that people are using it for not only our assessments and for the coalition information, but they're using it to write grants and doing a lot of other things that I never anticipated. I think the visuals and the ease of putting the reports together have just been so easy, and the presentations that you can put together for are just phenomenal, and we've done a lot of presentations. When I went just starting the coalitions in each of our counties where we have a hospital, I would take the HCI demo with me and hand out just a packet and then do it online, and people are just blown away that you can compare this to this county to that county and compare it by state. And it was just amazing to me how they all jumped on it. And this was my first meeting with most of these places. They didn't know me. They just knew I was coming in, and I needed their help with these assessments, and we wanted to partner. And to be able to bring that type of material and a tool in, it really, to me, it was a benefit that I never anticipated how well it would be received. My staff received it very well, and the folks at the hospital. But for the community, to see the community engage with this type of tool, it was amazing. So our goal was for each of our hospitals, and that's what my department's corporate community wellness. So what we did was go in, and if there was a public health department or a coalition that had already been meeting, we would try to go in, make our presentation, and say, this is what Integris would like to do in this community. Can we help you, and can you help us partner? And what was amazing is how many people were either they hadn't been meeting with any regularity, and we've pulled several of them, kind of dusted off, and they've started meeting again. And we've kind of given them some purpose to go ahead and say, you know what, Integris is here. They've got the Healthy Communities Institute sites that we can use, and then we're working together to put strategic plans together for each community where we have a hospital. And that's been the amazing thing. Even though the IRS is kind of making us play together, the partnerships and the collaboration that I have been able to network, I never dreamed how easy it would be. And again, this product has been kind of the way I got into each of the meetings, so it's been nice. I think the biggest surprise has been how easy it's been to work together. I really thought that it was going to be a much harder sell to go in. Even though in each of our communities, our hospitals are usually the biggest employer in that county. So I just thought it was going to be a much harder process of getting people together. But luckily, a lot of the health departments and the hospital employees that were in these counties, many of them had already been working with some of these coalitions, but some of them may have been doing something else for maternal child health, or they may have a specialty. Well, we pulled them in together and just said, hey, we would like to see let's find those top 5 negative health indicators. And this is what HCI is showing. So I would go in there with the report showing what HCI said. These are the top 10 negative health indicators in this county. Let's talk about what we can do to make some positive impact.